So the first thing I'm going to do is check my doctor's orders, make sure I have the right patient. I have Jane Tripp, 567-324009. I'm going to check the orders and see that it is time for me to do suctioning for Jane's trach, and it is. Before I go in the room, I'm going to gather my supplies. So I'm going to get an oral suction and an oral care tray kit, a suction catheter kit, and a normal saline, sterile normal saline. I'm going to check the expiration on everything. This is good. These two say that they're sterile until opened or damaged, so everything looks good. I'm going to go in the room. Hi Jane, my name is Awaz. I'm going to be your nurse today. Can you please verify your name and your birthday for me? Alright, Jane Tripp, 10/31/53, perfect. I'm going to provide for privacy. So Jane, today I'm just going to be suctioning out your trach to help you out. Can you tell me if you're having any pain or if you're having any shortness of breath, chest pain, anything like that?
I'm not having any pain.
Okay. So I'm just going to sit you up a little bit, okay? So I'm going to put the bed in Sunny Fowler's position. Okay. So I'm just going to get clean gloves. I'm going to provide for privacy. So, Jane, I'm just going to take a listen to your lungs, okay?
Okay.
So I'm going to hook her up to O2 so I can have continuous O2 monitoring throughout the suctioning. And I would have checked in the chart beforehand what her baseline was to make sure to see if any crackles or anything was in her baseline, but I'm going to go ahead and listen as well. Exposure. So take a deep breath every time I move my stethoscope.
Crackles.
Crackles. Deep breaths. And I would also have her sit up and I auscultate posteriorly as well. So I heard crackles, and for the purpose of the scale, I'm going to say that's outside of her baseline. So I'm going to go ahead and continue with the suctioning. So she's gone on O2, so I'm going to make sure I monitor that. And if it dips below her baseline or whatever's in that hospital policy, I'm going to go ahead and stop. Before I get my supplies ready, I'm going to make sure that my table's clean. I'm going to wipe it down. I'm going to loosen the aerosol trach collar. I'm also going to put the pressure of the suction onto 110 because it's supposed to be from 100 to 120. And I'm also going to loosen the cap on my saline water. So once that's all done, oh, and I'm also going to lower the railing. I'm going to perform hand hygiene. That's loosened. And open this. I would also have brought like an extra pair of sterile gloves in case I messed up, or I could always hit the call light if I did. If I broke sterility, I would have started again. I'm going to go ahead and get this open. Okay, so then with my non-dominant hand, I'm going to grab my saline water. And this is the hand that's going to be dirty, and I would pour saline water in. And then I put my dirty hand. Alright, so I would dip the suction, and then I would attach, and And then just to make sure that it's working, I go ahead and test out my suction, and it's working. All right, Jane, so I'm gonna loosen her, the cap, or take the cap off. And then I'm not gonna suction, I'm gonna insert until I feel resistance. And then she'll either cough, or if she doesn't cough, I'll ask her to cough. And I would pull out 1 centimeter, and then I'd start suctioning intermittently for no more than 10 to 15 seconds. And then once that's done, I cover her again. All right, Jane, can you go ahead and take some deep breaths for me? Cough if you need to. And then as I'm doing this, I would be watching her O2, making sure that her O2 saturation looks good. And then I come back over here. I'd insert until I meet resistance and she coughs. I'd ask her to cough. Thank you. And then I would 10 to 15 seconds intermittently suction. Jane, how are you feeling? Are you feeling a little better?
Yeah, I do feel better. Thank you.
Alright, that sounds good. If she wasn't, I would continue to suction as needed. But since she said she's feeling okay, I'm gonna go ahead and take this off. And then hang it up here for now. And then at this point, I don't have to be sterile anymore because she's all covered. And then I'm gonna go ahead and listen to her breath sounds again to make sure that she's improved. So just take a deep breath every time I move my stethoscope.
Clear. Clear. Clear all the way around.
Okay. And I'd have her sit up and I'd auscultate posteriorly as well and make sure she's okay. All right, Jane, and then I'm gonna just lift this up for now. But I'm also going to do some oral care, so I'm gonna hook up the suction to the yonker, or however that's pronounced. And then I'm gonna go ahead and suction her mouth. And then once that looks good, I'm gonna disconnect this. And I'm gonna get my oral care suction kit. I'm gonna get the mouth rinse and then dip the this like gauze suction into it. Attach it to my suction. And I'm gonna suction, or I'm gonna continue oral care. All right, looks good. And then once I'm all done, I assume that I would like tighten the collar again, and I would turn off my suction. I'd make sure she's okay, like vitals wise, and I'd lower the bed. Jane, can I get you anything else right now, or are you all right?
No, I'm okay.
Okay, so the bed's in the lowest position, and are you okay with sitting up like this, or do you want to be laid down?
I want to sit up.
Okay, she can sit up. So I'm just gonna leave that there, and then I would throw away all my trash and perform hand hygiene, and then I would go to document for my patient, make sure she had the colic too. And then for documentation, I would be documenting the color, consistency, amount, and any odor, if there was any, for the sputum that I collected. And I would also document how she tolerated the procedure, if she had any pain, or if she tolerated the procedure well. And that's it.